Osteoarthritis. It is one of the most widespread conditions among older adults, affecting the joints where bones meet. Over time, the cartilage that cushions these joints gradually wears down, leaving bones to rub against each other. This causes pain, stiffness, and swelling, most commonly in the knees, hips, and hands. The condition tends to develop slowly over decades, which is why so many people first notice it in their 60s or 70s. Daily activities like climbing stairs or opening jars become harder, and the discomfort often builds up toward the end of the day. There is no cure, but movement, physical therapy, and certain medications can make a significant difference in how people manage it. Hypertension. Known more commonly as high blood pressure, this condition affects a large portion of the elderly population worldwide. Blood pressure measures the force that blood pushes against the walls of arteries as the heart pumps. When that force stays consistently too high, it puts strain on the heart, the blood vessels, and organs like the kidneys and brain. The tricky part is that hypertension rarely causes noticeable symptoms on its own, which is why it has long been called a silent condition. Over years, if left unmanaged, it can lead to heart attacks, strokes, and kidney failure. Lifestyle changes and medication are both commonly used to keep blood pressure within a safe range. Type 2, diabetes. This disease affects how the body processes blood sugar or glucose. In a healthy body, the hormone insulin helps move glucose from the bloodstream into cells to be used as energy. In type 2 diabetes, the body either does not produce enough insulin or does not respond to it properly, causing blood sugar levels to rise over time. Older adults are particularly vulnerable because the body's ability to regulate insulin naturally declines with age. Excess weight, physical inactivity, and family history all increase the risk. If blood sugar stays elevated for too long, it can damage nerves, blood vessels, eyes, and kidneys. Managing the condition involves diet, exercise, regular monitoring, and, often, medication. Heart disease. It remains the leading cause of death among elderly people in most parts of the world. The term covers several conditions that affect the heart structure and function, but the most common form involves a buildup of fatty deposits inside the arteries that supply blood to the heart muscle. As these arteries narrow, the heart receives less oxygen-rich blood, which can cause chest pain or eventually trigger a heart attack. Risk factors like high blood pressure, diabetes, smoking, and high cholesterol all compound over a lifetime, making the elderly population especially susceptible. Treatment ranges from lifestyle changes and medications to surgical procedures like stents or bypass surgery. Chronic obstructive pulmonary disease. More commonly referred to as COPD, this is a long-term lung condition that makes breathing progressively more difficult. It develops when the airways and air sacs in the lungs become damaged or inflamed, reducing the amount of air that can flow in and out. Smoking is by far the most common cause, though long-term exposure to air pollution, dust, or chemical fumes can also play a role. People with COPD often experience a persistent cough, shortness of breath, and frequent chest infections. Because the lungs have a remarkable ability to compensate for damage in the early stages, many people are not diagnosed until the disease is already moderately advanced. While there is no way to reverse the damage, inhalers, pulmonary rehabilitation, and lifestyle changes can slow progression. Stroke. A stroke occurs when the blood supply to part of the brain is suddenly cut off, either by a blocked artery or a burst blood vessel. Without a steady supply of blood, brain cells begin to die within minutes, which is why time is so critical during a stroke. The effects depend entirely on which part of the brain is affected and how long the interruption lasts. Some people lose the ability to speak, others experience paralysis on one side of the body, and some recover with relatively minor effects. Age is one of the biggest risk factors, as the arteries naturally become stiffer and more prone to blockage over time. High blood pressure, atrial fibrillation, and diabetes all raise the risk further. Recovery often involves extensive rehabilitation to help the brain find new pathways for lost functions. Alzheimer's disease. It is the most common form of dementia, and it slowly dismantles a person's memory, thinking, and ability to carry out everyday tasks. The disease involves the buildup of abnormal protein clusters in the brain. which disrupt the connections between nerve cells and eventually cause them to die. Early signs are often subtle, such as forgetting recent conversations or struggling to find familiar words. Over years, the condition progresses to a point where a person may no longer recognize family members or be able to care for themselves. The exact cause is not fully understood, though age, genetics, and certain lifestyle factors all appear to contribute. There is currently no cure, and treatments focus primarily on managing symptoms and slowing the rate of decline. Osteoporosis. This condition causes bones to become weak and brittle over time, making fractures far more likely even from minor falls or bumps. Bone is living tissue that the body constantly breaks down and rebuilds, but as people age, the breakdown begins to outpace the rebuilding. Women are particularly at risk after menopause, when a drop in estrogen accelerates bone loss. The condition itself is painless and often goes undetected until a fracture occurs, most commonly in the hip, wrist, or spine. Hip fractures in elderly people are especially serious, as they can lead to long periods of immobility and significant complications. Calcium, vitamin D, weight-bearing exercise, and certain medications all help maintain bone density and reduce fracture risk. Parkinson's disease. It is a progressive neurological disorder that primarily affects movement and coordination. The disease develops when nerve cells in a specific part of the brain gradually stop producing a chemical called dopamine, which plays a key role in sending signals that control smooth, deliberate movement. As dopamine levels fall, people begin to notice tremors, muscle stiffness, and a slowing of movement. Balance problems and a characteristic shuffling walk are also common as the disease advances. Beyond movement, Parkinson's can affect sleep, mood, digestion, and cognitive function over time. The condition is more common in people over 60 and tends to progress at different rates in different individuals. While there is no cure, medications that boost or mimic dopamine can significantly improve quality of life for many years. Chronic kidney disease. The kidneys filter waste and excess fluid from the blood, and when they gradually lose this ability over time, the condition is known as chronic kidney disease. It often develops as a consequence of other long-standing conditions, particularly diabetes and high blood pressure, both of which damage the tiny blood vessels inside the kidneys. Because the kidneys can continue functioning at reduced capacity for a long time without obvious symptoms, the disease is frequently discovered late, often through routine blood or urine tests. As it progresses, waste products begin to build up in the body, leading to fatigue, swelling, and changes in urination. In advanced stages, dialysis or a kidney transplant may become necessary. Controlling blood pressure and blood sugar are the most important steps in slowing its progression. Atrial fibrillation. This is an irregular and often rapid heart rhythm that affects millions of older adults. In a normal heart, electrical signals coordinate each beat in an orderly sequence. In atrial fibrillation, these signals become chaotic, causing the upper chambers of the heart to quiver rather than contract properly. Some people feel palpitations, fatigue, or shortness of breath, while others have no symptoms at all. The condition itself is not immediately life-threatening, but it significantly raises the risk of stroke, because the irregular movement of blood through the heart can allow clots to form and travel to the brain. Treatment includes medications to control heart rate and rhythm, as well as blood thinners to reduce the risk of clotting. Cataracts. Over time, the natural lens inside the eye, which is normally clear, begins to cloud over, gradually blurring vision. This clouding is called a cataract, and it is among the most common age-related changes in the body. The lens is made mostly of water and protein, and as people age, some of that protein can clump together and block the passage of light. Colors may appear faded, night driving becomes more difficult, and bright lights can produce a glare that feels uncomfortable. The process is usually slow, unfolding over many years before it significantly affects daily life. Fortunately, cataract surgery is one of the most performed and most successful procedures in medicine, restoring clear vision by replacing the clouded lens with an artificial one. Depression. It is far more common among elderly people than many realize, and it is also frequently overlooked or mistaken for a natural part of aging. Major life changes that often accompany later life, including retirement, the loss of a spouse or close friends, declining health, and reduced independence, can all contribute to persistent feelings of sadness, emptiness, or hopelessness. Physical illness and certain medications can also trigger or worsen depressive episodes. Unlike temporary grief or low mood, clinical depression lingers and affects a person's ability to function day to day. It can reduce appetite, disturb sleep, and make existing physical conditions harder to manage. With the right support, including therapy, social connection, and in many cases medication, most people do see meaningful improvement.